While we are on the Prostate Cancer Awareness Month on 3rd September, somebody asked me, why robotics for a radical prostatectomy? And that's a wonderful question. So on one side, while we did attempt to spread awareness on this disease, cancer prostate, a malignancy which is so much fueled by hormone changes happening deep in the pelvis in an organ called prostate, which is so much related with men's health and with the hormones which actually govern the entire male environment and the milieu. We're also looking at the change which has happened not towards prostatic enlargement alone, but into a direction which is cancerous. A hormone-related tumor which gradually grows and quite deep in the pelvis can be cured if you in this awareness drive in the month of September could look into probably seeing your urologist in your cities in time. What does it mean? Men in their 50s and beyond who undergo changes in hormones as a result of changes in prostate, apart from the general men's health, which we talk about all the time from this channel. We look forward to making them understand that robotic radical prostatectomy is an intention to cure of a disease which is localized. So to attempt to pick up a localized disease or an early disease, that's what the language is of the society. We need to probably see our doctors in time. In other words, screening of individuals beyond 50 years as men who have got reasonable urinary issues or even no urinary issues, who complain about issues of obstruction and bothersomeness in urination, or who have undergone a health checkup where the PSA levels have been borderline or raised. The normal PSA level is anything between 0 to 4 nanogram per cent. Need to see a urologist who would clinically examine them, do a digital rectal examination, and correlate this clinical examination to various biochemical and imaging reports that he wants to correlate and look at. Is there an issue with your prostate? An issue with the prostate may be there as age changes. And one of the issues with the prostate today that we're talking about in the Prostate Cancer Awareness Month in September 2021 is prostate cancer. So friends, why robotics for radical prostatectomy? So radical prostatectomy is different from the regular prostate surgeries we do, where we remove the prostate internally, but leave the outer shell. In a common man's language, if you need to eat the coconut, you will eat the inner part of the coconut, leave the outer shell. So a TURP or a HOLEP kind of a surgery is where the urologist through the urinary passage takes a telescope, goes inside and clears the prostate internally. Like he eats the coconut internally and leaves the outer shell. The outer shell is the outer wall. You will never remove the outer wall or the room will collapse. So the outer wall is left intact. In doing so, he is actually giving you a reasonable passage or a passage of a young man where you can paint and pee on the wall and you can have a reasonable flow which you never had because of the obstruction. So that was a TURP or a prostate surgery for a benign disease. But when we talk about a cancer prostate and we're looking at awareness and picking up diseases early, at the Kokilaben Hospital, where I use robotics to actually clear or cure a prostate cancer, I would look at doing a very minimally invasive treatment, which has actually revolutionized the entire therapy of prostate cancer. Picking up a disease early by the awareness drives that we do with society as one now. On the 3rd of September today, the attempt directly is to look at reaching out to individuals who could have a prostate issue. Few of them could have a change towards prostate cancer. I picked up early and evaluated and imaged and looked at their stage still on a very localized form. We clear them with a minimally invasive therapy called radical robotic prostatectomy. So why robotics was the question which I was trying to attempt to elaborate. So why robotics? Because robotics is like a very fine precision where the instruments appear into the abdomen, into the tummy, through those ports or through those holes or very small incisions, where we can reach a very challenging organ very deep in the pelvis. The prostate is surgically a challenge because it's lying very deep in the pelvis, which in the yesteryears and yesterdecades, we used to cut open and go inside. We still do it in countries and in cities and in locations where we do open surgery, which obviously has been efficient surgery and the state of art in that era. But in the era where you exist, you travel from Maruti to Ferrari. You still have the car on 4 wheels, but it's a different ballgame altogether. Out here, you actually are able to clear the prostate completely. I was talking about benign prostate where we leave the outer shell. Out here, the prostate cancer is in the prostate and we're attempting to clear the entire prostate. In doing so, we're reaching a very challenging location where we don't have to open the tummy anymore. We are through very fine and specific ports by a remote control console where I would sit and I would actually remotely control all these ports which are inside the abdomen, 5 meters away where the patient is lying down, through precision where we reach the prostate. Once we reach the prostate, we are looking at 2 important things: clearing the disease and keeping the man a male and capable enough to pass his urine and continue to have good erections. That means we're looking at him being continent and capable of his erections. If a disease is localized and a disease can be taken up by a nerve sparing approach, we normally set on the level of the prostate and capsule and remove the entire prostate by a robotic move. That means we have got organs very close by. The organ just behind is the rectum or the motion passage, absolutely in close approximation with the prostate. On both the sides are pelvic walls, and there are umpteen number of nerves and vessels which cross. So a challenge of a prostate organ, which is cancerous, which needs to be cleared completely because there's a cancer that's localized and disease can be completely cleared, can be done so best by robotics in terms of a very precise and a very localized way. When we do that, in the first part of the surgery, our attempt is to look at clearing the entire prostate, the seminal vesicles, attempting a nerve sparing, if it can be reasonably done, because our main interest right now is an oncological control, a cancer cure. That's what we're doing. While doing so, we reach very close to the control location called the sphincter zone. That means we reach very close to the door. And we're reaching there as a urologist, as a person who is involved deeply in the continence and the control mechanism of individuals who come with incontinence issues. We look at being very, very close to the continence mechanism, but at the same time, reasonably able to remove the entire prostate. Many a times, if in doubt, we send a frozen section of organs which are, or locations which are left over to be more than reasonably sure that we have cleared the entire cancer. So why robotics? Because you have today in 2021, that kind of a technology which drives you to clear the prostate cancer with a minimally invasive approach. The patient, though, pays a little extra, but gets a minimally invasive approach where he recovers much faster. Gone are the days when there was a long cut and the recovery and pain issues and the amount of bleeding used to happen. With so much of precision and with the high amount of magnification that we do in the robotics, that we at Cochlear Hospital have got two high generation robotics called the XI and the SI, and we use both of them in tandem, whichever I need to use. We have looked at the kind of prostate cancers which have come as very high grade and which have come in low grade. Which we have looked at patients who have been salvaged post-radiotherapy. We have looked at patients who actually had a very large prostate or a very small prostate. But at the end of it, we are able to clear these prostate cancers reasonably. Removing the prostate cancer comes to the other approach where we're going to reconstruct on the table. What are we going to reconstruct? An organ has been removed. And we have to now reconstruct the bladder and join it to the urethra to have a flow along with a continence mechanism. So prime interest during the first part of the surgery is to clear the cancer. The prime interest in the second part of the surgery is a reconstructive approach where we are going to do a vesicourethral anastomosis. And that's where we stretch around with those important kind of telescopic arms we have, which have those 360-degree of rotation. A man's arm can move this much, but these can move in a very amazing kind of direction. It gives me that flexibility where I can move my needles and my sutures in directions which I choose to, which I could never imagine in the past. So robotics has been a kind of a revolution, which in many surgeries, cancer surgeries and other reconstructive urology surgeries, which I talk about, and we've been doing it regularly over the last 6-7 years, has actually revolutionized a surgeon's capability completely. You're able to do something with open hands, you're able to do something with minimally invasive surgery, but at the end of it, the result should come. And the result comes with a least morbidity, with good amount of recovery, and recovery much faster. So it's important for us to look at this Cancer Prostate Awareness Month, whereby we are looking at making the society aware, making men in our society aware that they need to see their urologists in their cities. Every man beyond 50s need to have a reasonable approximation, an idea about prostate changes and urinary complaints. Cannot really postpone urinary complaints anymore in a modern India. Healthcare is already there. It's important for you to take health to the front row seat. And that is where this kind of an awareness in September, which is the Prostate Cancer Awareness Month, goes very tall for people who could actually understand, take it forward to the highest level.